Dr. Ashish Jha, there is also the concern over vaccine nationalism. Now, the European Union has finalized a deal for 300 million doses. The US, with a population of 328 million, has ordered 100 million doses with rights to acquire 500 million more. It almost seems as if they're trying to corner the market. Pfizer has said that 80% of the vaccine doses it will produce by the end of next year have already been bought out by countries that represent only 14% of the world population. And in the middle of all of this, there are concerns about how the vaccine project will be rolled out, because a lot of the effort that's happening globally is part of the Gavi Global Alliance for Vaccines. How do you see vaccine nationalism impact the rollout of the Indian vaccine?
Yeah, so thank you for having me on, Rahul. I think this is a real problem. I think vaccine nationalism is hugely problematic. This is a global pandemic, and we really need a global approach. And so the Gavi Alliance that you mentioned, there's a program called COVAX, WHO, Gavi, others have gotten together. America under President Trump has been the one major country that is not participating. I think that will change under a President Biden, where America will start, I think, becoming a member of the global community again. But the problem right now is everybody wants to vaccinate their own population first. Again, I agree with the idea that India is in a good situation because India has a lot of indigenous manufacturing capacity. In fact, is one of the major manufacturers of vaccines for the world. But right now, none of the two vaccines that are look like they're sort of the furthest ahead, Pfizer and Moderna, I don't believe either of them is going to be manufactured in India anytime super soon. We do need to sort of think about how do we ramp up production, going beyond just the Oxford vaccine to others that are in late stage, so that Indian people can start getting it sooner rather than later. I completely agree. We've got to get it to the high-risk people first. But this is going to be a very big challenge for India. I'm also just worried about countries that don't have the same level of indigenous manufacturing capacity the way India does, about what will they do and how long will it take to get people in those countries vaccinated.
Okay, let me put that question then to Dr. V.K. Paul. Dr. Paul, here's the concern that the two vaccine candidates that are actually right ahead of the curve at this moment, whether it's Moderna or Pfizer, neither of them have plans to come into India, because Moderna, for example, is a biotech startup. They're looking to make their own money, earn their own valuation. Their stock prices are going up, but they're focused largely on the US and whoever else can afford them, and the same is the case with Pfizer. So where does that leave the Indian vaccines? These are the two vaccine companies that are most ahead on international parameters, and neither of them are coming to India. Is that something which is of concern to you, Dr. Paul?
Two parts. One is that for these two vaccines, if their external supplies to other countries are going to be thin or negligible for a long period of time, we have to factor that in. All nations will have to factor that in. But for India, this is hopefully not a worry, because I explained to you just now that we have our own vaccines, vaccines that are being manufactured in India, and two vaccines that are being developed in India, and therefore we are definitely in a somewhat different situation. And here I also want to emphasize that unlike other countries, the Honorable Prime Minister has clearly stated and impressed the principle that India's vaccine capacity and capability and manufacturing depth is not only for India but for the world, for the humanity. And therefore, when India would take decisions about utilizing the capacity of vaccine production in the country, this principle will be borne in mind. I'm very happy to state that already 200 million doses of the serum vaccine manufactured in India will be made available to COVAX facility. And that's a global facility. That's already a contribution which India's manufacturing enterprise is making for the world. And the same principle will be applied when other vaccines reach that stage where it is possible for the vaccine to move on to an uptake